My patient TH is a 51-year-old Caucasian male construction worker who is married with 2 children, 1 male and 1 female child, who visit frequently. My patient has a past medical history including hypertension and multicentric Castleman's disease diagnosed in April 2018. Past surgeries included a tracheostomy, a peg placement, and a chest tube thoracostomy. My patient is currently on a ventilator and unable to provide any history, so the bulk had to be obtained via medical charts. Patient originally complained of fever, chills, difficulty breathing, and an overall feeling of malaise before admission to an outside hospital. During admission, he was diagnosed with pneumonia and shortly after had significant hypoxic respiratory failure, which resulted in a tracheostomy. Also, during hospitalization, he did have spontaneous pneumothoraces, which resulted in the insertion of chest tubes, as well as he developed acute kidney failure, which required continuous renal replacement therapies. The patient had difficulty weaning from the ventilator and then was transferred to select specialty for further vent weaning. The drug that my patient was receiving that I focused on was enoxaparin, or trade name Lovenox, which is an anticoagulant and specifically a low molecular weight heparin. He is receiving 20 milligrams of Lovenox subcutaneously daily. The drug is an XA inhibitor, which means that the mechanism of action inactivates thrombin and factor XA to suppress formation of fibrin, so it treats and prevents thrombus formation. My patient had no adverse reactions to the drug, even though bleeding, aplastic anemia, and severely low levels of white blood cells are common adverse reactions. My patient was receiving Lovenox due to his hypertension and as a preventative factor considering immobility. You need to educate the patient and family on safety precautions and what to do if the patient receives any lacerations. You also should be monitoring his PT and INR.